Even when I was still in med school, I was very interested in pediatrics. And then after I trained pediatrics in the Philippines, one of my mentors happened to be a neonatologist, and I was very inspired by the kind of work that he was doing in these very, very premature babies. So my goal then was to become a neonatologist like himself and be able to help those premature babies. I am Dr. Winston Manimtim, and I am one of the neonatologists here at Children's Mercy. Within neonatology, my focus is really on those premature babies who develop chronic lung disease. That means after their initial period of being very, very premature, and then over time, they may not necessarily be weaned off the ventilator yet, so they continue to require respiratory support. And those are the kind of babies that I become more and more involved with. As a neonatologist, we obviously take care of these very, very premature infants in the NICU. Some of them stay with us for months and months and months, and even after that, they may still need the respiratory support that they may not necessarily be ready to go home yet. But at some point, once they are stable enough and they have the tracheostomy placed and already are switched to the home ventilator, then at that point, they will be ready to go home. Our program is so unique in the sense that we are the only program in the country that takes care of both the specialty and the primary care needs of our patient. They always have somebody that they can call 24/7 if they have any questions, if their kid becomes sick at home, and things like that. I personally take pride in being able to provide that kind of service with the help of my partners as well as the other members of the multidisciplinary team that takes care of our patients in our clinic. It's really very motivating and very inspiring to me, knowing that, in the beginning, they were very, very sick, and yet they were able to overcome almost all of the obstacles that they have faced and really doing very well.